I'm Deja Young, a licensed esthetician here at Fulcrum Aesthetics. Just gonna wait a few moments to let everyone join in. All right, so we can get started. So, like I said, I'm Deja Young, a licensed esthetician here at Fulcrum Aesthetics, and today we're going to be talking about collagen regeneration with microneedling. It's one of my favorite treatments. Okay. So, what is microneedling? It is a minimally invasive treatment that causes the body to. So, what we do is we create little micro wounds within the skin, and that forces the body to want to repair itself. And so, in that repairing stage, you stimulate more collagen elastin, which is going to help smooth out fine lines and wrinkles, help with textural issues, and just give you an overall skin rejuvenation. Some unique specs about the skin pin device is that it is the first FDA microneedling device, cleared, FDA cleared microneedling device, and it has adjustable needle depth, so it can go as shallow as 0.25 millimeters or as deep as 2.5 millimeters. And it can treat both the face and the body, which is nice. And my favorite part about it is that it's safe for all Fitzpatrick. So all skin tones are available to receive this treatment without any issues. So, like I said, the microneedling stimulates more collagen and elastin, but what is collagen and why is it important? So, collagen is a structural protein responsible for firmness, elasticity, and resilience. And so, around the age of 25, we do start to lose 1% of collagen. And when we do start to lose that collagen, you'll notice some signs of fine lines and wrinkles, some skin laxity, enlarged pores, some rough texture, or you'll notice that your skin is just a little slower to healing if there was some trauma that happened to the skin. So what's nice about the microneedling is that we're stimulating more of that collagen elastin so that you just don't see those signs as quickly as if you didn't do anything at all. And this is just a little graph of what it could look like if you do start to experience some loss of collagen. So, how does microneedling stimulate collagen and elastin? So, when we are creating these micro wounds into the skin, we are triggering inflammation. And when that inflammation is triggered, the body is going to start to release some growth factors, and you'll get increased blood flow, which is why you typically look a little red post microneedling, and some cellular signals begin. So, this inflammation process typically lasts about 24 hours, you're in that inflammatory cascade, which is typically why we say avoid doing anything within the first 24 hours because your body is in repair mode at that moment. Then we get into phase two, which is proliferation. So your fibroblasts are going to get activated, that collagen and elastin is going to start to form, and your tissue will start to rebuild again. So the proliferation phase is about the week that you're recovering, is when you're in that phase two. And then we get into phase three, which is the remodeling. So we're going to start to see that collagen mature and reorganize within the skin, and your skin is going to become smoother, firmer, and stronger. So this phase is, like I said, about a week post your recovery, and it lasts for a few weeks too, which is why it takes a little time for that collagen and elastin to reveal itself because the body just needs time for that collagen to mature. So you'll definitely notice a difference after a week from your treatment. You'll notice a nice glow. But in terms of textural issues and then overall skin rejuvenation, that does take a few weeks. So I always like to say that microneedling is the gift that keeps on giving because after your final treatment, again, you'll notice a difference, but you'll notice even more of a difference a few months after your final treatment because that collagen and elastin is still continue to grow and expand. So, I would say the biggest thing that microneedling is amazing for is helping with textural issues. So it's perfect for those who are experiencing some rough texture, some fine lines and wrinkles, a little bit of mild laxity. If your laxity is too much, then we might need to go into more advanced treatment like laser or surgery, depending on the severity of the laxity. And it is great a little bit for pigmentation if you're someone who's struggling with PIE, which is post-inflammatory erythema, which is what you'll get after a breakout. It kind of leaves like a little bit of red mark, or you can get a dark mark if you are someone who has like a darker complexion. It will kind of help lift that pigment out of the skin, but that's not its main thing. I would suggest other treatments for those. But if you are experiencing that, microneedling can help a little bit with it. So, who is an ideal candidate for microneedling? It is going to be someone who is experiencing some textural issues like acne scars, enlarged pores, fine lines and wrinkles, those who are looking for overall skin rejuvenation or early prevention for anti-aging, or those who are just kind of looking for a nice glow to their skin. Microneedling is going to provide that for you. Those who are not able to receive microneedling are going to be those who have keloid scarring. Keloid is an overgrowth of scar tissue and it's caused by trauma. So you don't want to introduce more trauma into the skin because it can create more keloids, which are a pretty difficult treatment or pretty difficult skin lesion to treat. So it's best to just err on the safe side and not move forward with that treatment and do other things instead. If you have an active infection, open wounds, or if you're pregnancy and breastfeeding, if you're taking certain topical medications for the skin, you might not be a good candidate. Or if you're currently taking Accutane, or if you recently just got off of Accutane, you want to avoid getting microneedling. So, a recommended treatment series is the question I get a lot in my treatment room. So, in a perfect world, if you're someone who's in your 20s or your 30s and you're just looking to get ahead of the signs of aging, I would recommend a series of three, spaced anywhere between 4 to 6 weeks apart. And this is going to help, like I said, stimulate that collagen and elastin, give you a nice glow, and good for anti-aging. And just really improve the skin because it's going to be preventative and anti-aging. If you're someone who's dealing with more severe issues such as acne scars, or if you're a little bit older and you do have deep set fine lines and wrinkles, you are going to require more treatment. I typically like to recommend anywhere between 4 to 6 treatments, again, spaced about 4 to 6 weeks apart. This is going to allow the body just to treat those concerns a little bit more advanced than if we were to just do the simple 3 sessions. And then if you are just dealing with like really severe acne scars or really severe textural issues, you might be better to do either a compounded treatment, so like microneedling plus a laser or microneedling plus a chemical peel, or some add-ons like PDGF or PRP just to really treat those advanced concerns. And again, you still might be closer around 4 to 6 sessions versus the traditional 3 sessions. Okay, so a maintenance treatment. If you are someone who's just trying to do more of like a preventative and overall skin rejuvenation, I would say once you complete your 3 sessions, coming back every 12 months, so once a year is going to be ideal for you, just to keep the good things going and so that we don't lose what we worked so hard on with the first 3 sessions that we did. If you're someone who's dealing with more advanced skin concerns, like I said, acne scars or deep set fine lines and wrinkles, you're looking a little closer to coming in every 6 months, just so we can be really diligent with targeting those concerns. And again, not lose the progress that we made on those initial treatment series. So, what to expect after microneedling? Typically, my patients are red for about 24 to 72 hours. Like I said before, your skin is in that inflammatory cascade, so it just needs time to heal. Once the 24 to 72 hours are up, you might notice some mild dryness or tightness of the skin, and you might even notice a little flaking of the skin as it starts to epithelialize. A good rule of thumb for your post-care is always to stick with gentle cleansers, gentle moisturizers, a hydrating serum, and SPF. You do want to avoid using any active ingredients during the week of your recovery. So no retinols, no exfoliants, or any harsh products on the skin. Nothing that's like super fragrant too, especially if you are someone who has a sensitive barrier. You also want to avoid exercising for the first 24 to 48 hours. Excess heat, again, we don't want to put too much inflammation within the skin. And then, of course, sun exposure. Everyone should be wearing their SPF. So some nice enhancements to pair well with microneedling that we offer here in clinic can be our PRP, which is where we take out your own blood, separate the plasma from that, and microneedle it into the skin. PDGF, which is a non-invasive treatment, so we don't need to draw your blood, but it's platelet-derived growth factors that we apply to the skin once we're done microneedling. And this is going to be phenomenal for stimulating more of that collagen elastin production, really helping with textural issues and giving the skin a nice glow. Lumicin, which is a salmon DNA that's been pretty popular in this industry for a few years now. This is going to really hydrate the skin and give a nice barrier to the skin. And then we have our Toscani peptides. We have a few different peptides, so depending on what your specific concerns are, we can make a little cocktail for you, and we can even add in that Lumicin too, just to address all of your skin concerns. And then lastly, we have our CO2 lift mask, which is kind of like a jelly mask that we apply after microneedling. This is going to flood the skin with oxygen, which is going to be great for healing the skin, and it feels really nice. Sometimes you can feel a little hot after microneedling, so it feels really nice and cooling to the skin. So, because you guys joined my lovely little webinar, I do have a little gift for you. So, you will receive $300 off a packaging of microneedling. You must book your appointment by June 5th, but you don't have to come in by June 5th. You can schedule whenever to receive this discount. So you can just scan that little QR code to get your little $300 off your microneedling session. And then I'm just gonna see if we have some questions that I can answer. So someone asked, what is your favorite or most effective add-on? Well, I will say all of the add-ons that we offer here are phenomenal, but if I had to choose, I would say PDGF. That one is super popular here in our clinic. Even with one session of the PDGF, I've seen a phenomenal difference in the skin, especially in the under eye area. I feel like a lot of people have concerns with the under eye, and I feel like it makes a big difference if you're dealing with dark circles, fine lines and wrinkles, or even just like a little bit of hollowness. I think the PDGF really does make a difference within the skin, especially in that area. Another question is, how much time should I give myself between a microneedling appointment and an event? Most patients are good to go by that 7 day mark. However, if you want to err on the side of caution, I would say give yourself at least 2 weeks because some patients are just slow responders. So give yourself a good buffer. That way you don't have to worry about your skin still being a little flaky from the microneedling. Someone else asked, is this something that should be part of a wedding planning? Yes, especially because I feel like the downtime for microneedling is not that bad. You're gonna get that nice overall skin rejuvenation, give your skin a nice glow, and I just love microneedling, so I think you guys will love it too, whether you're planning for a wedding or not, but especially if you're planning for a wedding, I think it's something that should be a part of your treatment plan. And then someone asked, what is the cost for that add-on? If we're talking about the PDGF, It is a $500 add-on. I want to say the total cost of the treatment is around 900. We do include the neck for all of our treatments. So you would get face and neck done plus the PDGF. We don't do hydrofacials here. Someone asked, can you add a hydrofacial? We do the Diamond Glow, which is pretty similar to the hydrofacial. And we can do a stacked treatment together. So we would do the Diamond Glow first, give your skin a nice little facial, exfoliate, and then do the microneedling after that. And then if you wanted to do add-ons, we can do that as well. Gosh, these questions are rolling in, you guys. Okay, I think that's it. I'm gonna exit out of that. So I'm so glad that you guys were able to join me today. But before you go, I just want to tell you about the next webinar we're having next week. And that is going to be with Brittany. She is going to talk about preparing for your filler appointment. So if any of you guys are interested in filler and wanting to know more information about that, I highly recommend tuning into this webinar. Thank you for joining me and have a wonderful day.